All right, I think we're connected, everybody. Welcome, welcome. Hope you all are getting settled in. I'm David Eaton, as this nice title slide says, nurse practitioner at Seattle Children's Autism Center. Welcome tonight. We have Autism 207, Mental Health for Autistic Adults Without Intellectual Impairment tonight. Again, thanks for joining us. We're really going to be focusing on this is part 2 of our adult series during the summer that we like to do, focusing on topics affecting our adult autism community. I want to thank you for joining us online. Thanks in advance to our panelists who you'll meet in a moment. And thanks to everybody. There they are. Awesome. Thanks for sharing your advice. It's going to be a great evening. Again, mental health and autistic adults without intellectual impairment. As a note, reference back to our Autism 206 lecture from last month. That's one that we had on mental health and autistic adults with intellectual impairment. So, definitely there may be some crossover in this. There's not any defined line necessarily about treatment methods or approaches or differences, with or without intellectual disability, but we're going to be focusing on kind of what are some of the main points for adults with intellectual disability. I also want to recognize that with this kind of panel discussion, we'll be using both a combination of person first and identity first language, just kind of, off the cuff tonight. It's going to be in an interchangeable way. I know that there are preferences out there and they're very individualized, so I appreciate your grace with that as we kind of talk about things tonight. I also just want to mention that, we have many Autism 200 series lectures viewable through the children's YouTube playlist, as well as our Autism 200 website through the Facebook Live here. You can look at those past videos. Thanks to Raylani, who's monitoring comments, so send in your comments and questions tonight. And thanks to the Seattle Children's AV and Tech team, including Patrick behind the scenes, that's making tonight possible. So without further ado, I'll jump into introducing our panelists. I think first of all, we have Dr. Rosalind Odie, clinical psychologist at Child and Adolescent Psychological Services, CAPS. Hi, Roz.
Hi, everyone.
Awesome. And we also have Ben Wall, who is a social worker and founder of the Aspiring Youth Program at Ryther. Hi, Ben.
Hello.
And we also have Natasha Harrington, PsyD, a clinical psychologist, autistic clinical psychologist on our panel tonight. So thanks for joining us, Natasha. Oh, and I think Natasha, it looks like does it say you're muted? There you go. Now you're good. Hello. So again, just a brief, before we jump into the panelists, we're going to be discussing services, navigation tips, barriers, and our hopes for autistic adults without intellectual disability, or ID, if we might say that tonight. ID corresponds to intellectual disability. And really, we're looking to help these adults as they strive for independence in their lives. And I really kind of feel that often when I see patients, one thing that is a common pattern that we know about is that can really derail success for these adults can be co-occurring mental health conditions. We have some statistics on that as well, but that can be a really big challenge. So to the degree that we can, and maybe we can't, we'll try and separate out, what are these mental health aspects that we're trying to support versus what are, autism challenges that might, you might be responding to them in different ways. Potentially that might be, quote, just part of their autism, or is this a mental health aspect to their challenges? Also, when we recognize these diagnoses, which can include ADHD, anxiety, depression, bipolar disorder, obsessive compulsive disorder, others as well, it might manifest in many different ways. So it might be, particularly severe in one individual, or it might look relatively mild for another individual, but it really is impairing their otherwise what they could be having as a lot of success. So again, just treating it, no matter if we're talking about very severe clinical depression or suicidality, or something that is, just impairing their everyday functioning, this is something that we want to draw attention to. So without getting into it or without continuing to ramble on more and more, I do want to recognize that, part of tonight will also focus on COVID. We're not in normal times, and we know that normal times, even, mental health services are not easy to access and navigate. So we know that, ever increasing social isolation related to COVID, we're going to be talking about that tonight, and hopefully providing some resources both right now during this time period of how we're restricted from COVID connections with people, and also then how to access it in kind of, quote, normal times. With that, I think we'll kind of just jump right in to our panel discussion, and we have our agenda that we kind of saw up there at the beginning briefly. First up on the agenda is kind of just talking about context and background about mental health conditions in autistic adults. And Rosalind, you were going to maybe kind of start us off there.
Sure. Yeah, I mean, I think we're all here because we recognize that mental health conditions are, co-occurring mental health conditions are very common among autistic adults, and often, oftentimes are even more are more impairing and create more of a challenge than the autism symptoms. Research supports that there's high rates. So, it ranges usually from about 50% to as high as 85% of people with autism have at least one, if not multiple co-occurring disorders. And, like you mentioned, that list, David, that pretty much, any diagnosis that a neurotypical person may have, also someone with autism can have. Mm-hmm. Research shows that often, like, the most common are anxiety and depression, but bipolar disorder, OCD, substance use disorders, all of those are prevalent as well. And I just want to touch a little bit on why, what research suggests, just get us talking a little bit about that. I know we'll talk a lot more about some of the environmental factors, but I think there's some research to suggest that there's, at least for some people with autism, there's a genetic vulnerability to some of these disorders. Some anxiety or ADHD or something like that sometimes runs in families. Yeah. And so there may be a vulnerability that then, interacts with the challenges that someone with autism faces, throughout their development. There's also, of course, the unique stressors that an autistic adult faces and faces throughout their life, related to bullying or social isolation. What was I going to say? And just lack of, understanding and proper accommodations in school. All of it can combine to create a difficult situation that they very understandably react to by, either withdrawing or developing coping strategies that aren't as effective.
Yeah, maladaptive coping strategies.
Yeah. And then, sometimes too, and you mentioned this a little bit about the overlap between autism symptoms and some of the symptoms of, say, like a OCD, for example. Yeah. So sometimes the repetitive behaviors that someone with autism might have, there can be a little bit of a gray area of where does it then cross the line into OCD. And sometimes it's, you're looking at, as a clinician, if I'm evaluating that, I'm looking at how impairing is it, how much anxiety, is it related more to anxiety? Is it something they're doing to reduce anxiety? How compulsive, how much is it related to an urge that they feel like they can control? But sometimes it's unclear, and it can definitely be a gray area. And I want to say one other thing too, just give another example of that overlap. Another one that comes up frequently that I see among my clients is some overlap between sensory sensitivities and those things contributing to anxiety. So it might be anxiety in certain environments, or, I'm thinking of a client I worked with who had was very sensitive to buzzing sounds, and then, had a specific phobia around insects and bugs and stuff. So there's, that contributing factor as well.
Totally.
And I could talk about treatment, but I think we're going to do that later.
Yeah, we'll get into that a little more detail. Maybe, I know that there, one thing, like we talked about, what are some of the like softer or less kind of impairing or less severe, clinical impairment, but then we go all the way to things like suicide, and that can be so prevalent just in the general population. I know that there have been some statistics that I've seen at recent kind of conferences over the last several years that have even like upwards of 30% of individuals on the autism spectrum have attempted suicide. Of course, there's no, what age that might happen, but just this is something that's totally prevalent as well. I just think it's helpful to recognize, talk about that, talk about Suicide Prevention Lifeline, a website, or talking about, we have some suicide resources on the last slide that we have to share. That's just really something that, again, I also want to call out too. So we're talking about it and not just having people feel like they have to hide those worries.
Absolutely. So critically important. because it is common, suicidal ideation, suicide attempts, and that, a lot of the predictors of suicidality are, things that are just so common among autistic individuals about, isolation, loneliness, and we could talk about that in the context of COVID too, right? And not feeling a sense of belonging.
Yeah.
And so understanding what can contribute to it also really helps us point us to the direction of then how do we support somebody?
Totally.
What are some of the factors that we can help?
Absolutely.
Help them with.
Great. And Ben, I think you kind of, especially with your background coming from the community, being involved in the community for so long, what are you hearing about kind of perspectives of individuals, autistic adults without intellectual impairment, either through your Writher and Aspiring Youth programming, or what you read in other forums as well?
Well, these are very tough times, and our clients, our families have faced challenges as well. So I think one of the things in talking to clients and also parents is that there's a built toughness and resiliency, born of thousands of frustrating IEP meetings or bullying, things like that. So, for neurotypicals, one might say this was a real shocker, and they're adjusting to all of these challenges. And I think a way to look at this as well is that autistic folks have really faced a lot of challenges throughout, and there is isolation, but I also would want to point to the incredible ways that this community comes together and supports each other. And there's examples, Square Pegs social groups, or things Arc of King County is doing, or Best Buddies, and just even more than that, just organically, I have a number of young adults who've stayed in touch since high school or middle school. I think that's really powerful. And I think, as a community, both for young adults, for parents and providers, to understand the concerns around mental health issues, around suicidality, to be open about that and supportive, but also to not be in fear, because I think there's a chance with fearing it so much that it feels shame or things like that. And I've seen, clients have really open, awesome conversations with each other, with their parents, with providers, to build support in the face of a lot of challenges, and challenges from COVID, challenges from bullies they've experienced, challenges from the fact that our community does not employ autistic folks at the rate they should. And that was long before COVID. And so again, that some of these feelings and emotions are a rational response to tough situations. Being open, making sure, I think for parents, providers, not overreacting to big statements. It's important for parents to remember they're often the safe place. So a young person may go to them with a lot of big emotions, and it is hard to figure out that threshold of like they're venting, they're unloading a lot of feelings right now, versus, okay, this is concerning to a degree where I really need to call a provider or get more support in place. And I think a key throughout is that the parents looking for ways to collaborate, to be an ally, that their young adult or teenager or kid doesn't feel like they're assessing them constantly, that they're there to help. I had a parent put it well. They said, I want to help, but I don't want to be intrusive. And I thought that was a good way to sum it up. And just lastly, really quick, maladaptive coping strategies. I feel like if I ever start a punk band, I kind of maladaptive coping strategies. I don't know. It just jumped out to me. I'd never thought of it that way, but if one had a punk band, I feel like it'd be a great band title.
I'll have you know that there already is a punk band that with the title of the Autistic Youth, FYI, that's out there. So that one's already taken.
Okay. We need to put that at the end in the follow-up blog so people can check them out.
All right. Great. we'll kind of be getting to your comments as we go too, or your questions as we go rather. I did want to, one thing to loop back around, Ben, that I know we've talked about in the past is just kind of, how you see what anxiety, what depression, what those symptoms look like. We focus a lot, I think, on 10-year-olds, that's like when you think about the autistic community, maybe you think about a younger person. And when we think about kind of older people on the spectrum, maybe we get like a picture of like, Sheldon from Big Bang Theory or other kind of more
no, don't say that.
sensation. Yeah, right. Fair enough. More sensationalized kind of visualizations of autism. Do you anything that you see kind of in the older adults that you feel like is a more realistic picture than what just kind of Sheldon looks like?
Yeah, I mean, first of all, the show Community, whose director identifies as autistic, Abed in that character. If you're looking for a more realistic, rounded portrayal. Is good. I don't think it's full representation because the actor Danny Pudi, who is excellent, isn't autistic, so it's not all the way to full representation. But I think let's not look to the Sheldons. That's a stereotyped sort of neurotic cardboard cutout, and I just think that with young adults, they're there, they want to contribute, but our society kind of calls them apathetic, or more currently the term super spreader. It's just 20-year-olds need to be respected as contributors to society in more ways, and that needs to happen through employment big time. Needs to happen with visibility in our community and our culture. And I would say that it's hard to see the challenges right now. The field has come a long ways, and that's good. And in general, there's more inclusion in our society, but I'd say we still have a long ways to go.
Awesome. Yeah, thanks, Ben. Natasha, how about yourself? I think, when we were teeing things up around this discussion topic, you had brought up a really interesting point about kind of this, dynamic of talking about whether somebody is anxious and depressed versus more just, stressed and demoralized, which is such a clear kind of way for me to think about it.
Yeah, I mean, when we talk about depression and anxiety, a lot of people get the impression of, oh, somebody has an irrational response. They have, negative patterns in their thinking. And so, the way to help them is that we can correct them and show them that things aren't so bad. And the reality is that for a lot of autistic people, like, things really are that bad with that environment that they're in. If someone spends their life, being in intensive correction, always telling them that, what they're doing isn't good enough. They need to change. They need to do these things that are, very painful for them sensory wise or so on. That there's, their perception is incorrect. They don't know their own mind and so on. And anyone who's in that situation is going to become stressed and is going to become demoralized, having your freedom limited. And so in a lot of ways, these, what we see as mental health problems are actually a very rational reaction to the situation that they're in. And that's the reaction that anybody would be having in that situation.
Totally.
I think, I was talking to a parent who was saying, she just wanted her child. She didn't want her child to be limiting herself. And she didn't want her child to be limiting herself. And she's saying, why can't, I want to show her that she can do these things that she thinks she can't do. And I said, there are some things, we get some negative limiting messages. There may be some things that are rational, but I said, what if she's right? What does it mean to you if she actually can't do these things? And that was just a revelation, because so many people have just not considered that possibility. And that's not saying that, autistic people can't be happy, be successful, achieve things, but the particular things that they're being asked to do, or the particular way in which they're being asked to do it, or even just this expectation that, every adult should have a full-time job. We need to really, really rethink some of these things.
I mentioned this is kind of off script, not something we discussed before. But when you talked about kind of what autistic adults are being expected to do, what comes up for me is actually, I guess it's not off script. It's in some of our records, but at this time, just bringing it up right now that Dora Raymaker is an autistic researcher who kind of has looked into different things about coping and passing. Is that kind of what you're thinking about when you say that?
Yeah. Yeah, that's something that has not been very explored in the research yet, but is very commonly discussed among autistic people, is a phenomenon called autistic burnout.
Burnout,
people
exactly.
Go, oh, this person's so successful, they're keeping up with their peers, they're not getting accommodations, and they think this is a huge success. And then the person, gets to 30, 40, whatever, and just crashes and burns because they've expended all of their energy to keep up that illusion that they're that they're functioning the same as everyone else.
Totally. I think that's also, it's like different. I think Dora Raymaker defines it as being different than depression for sure, but it's kind of in this continuum, to some degree at least.
Mm-hmm.
What about, I know you've talked in the past when we've discussed things about interdependence versus independence. Yeah,
Sarah Sanders Gardner, who does the wonderful autism program at Bellevue College, had an article about, independence is valued so highly when people talk about goals. We want our young adults to be independent. We want them to move out of the house. We want them to be doing their own laundry, cooking for themselves, and so on. And the reality is that pretty much none of us are actually independent. If you dropped us in the woods and we had to live there for an extended period, we would struggle. A lot of us would starve. But we've built up kind of this idea in the article. She talks about, you're not independent. If your toilet breaks, you don't fix it yourself. You're dependent on a plumber. But we've created this kind of, okay, this is a level normal of dependence. And so we're just going to pretend like that's not dependence. You're still independent if you need a plumber to fix your toilet. And so she really promotes the idea of interdependence, that it's okay not to be able to do every single thing yourself. And, instead we should be creating these systems where we can count on each other for the things that are harder or easier for a particular person.
Awesome. Thanks, Natasha. Yeah. I see a couple questions coming in that we'll kind of get to. I'll kind of slot them in as some topics are coming up. Carol has a question about kind of, her son, autistic adult, is sick of being single. Resources around that or gatherings. We'll talk about that actually in a few minutes here later on. Next kind of topic that we wanted to bring up though kind of is, how we're talking about these different presentations of, mental health issues in autistic adults. Maybe getting into a little bit next part on our agenda, looking at interventions or treatments. We kind of put it in quotes because I think, it's something that can be, there's very defined examples, and there's also, we continue to learn more and have, less defined examples of treatments and interventions. Rosalind, maybe you can start us off by talking about some of the options of treatment that are out there for different mental health conditions.
Sure. So, I think so I'm a cognitive behavioral therapist. That's how I'm trained. And I think, so I want to speak a little bit to that because, I think CBT gets a little bit of has some mixed, what would you say?
Perspectives.
Yeah, people have mixed opinions about CBT. Yeah. And what it is, it's a therapy that is focused on helping people recognize and identify their thoughts and their feelings and their, corresponding behaviors or actions. And then through, becoming more aware of those things, you could try to, either challenge your thinking patterns or, try to change how, your thinking patterns and change your behaviors and actions. And I think, while that can be helpful, and I see that as a really useful tool for helping people build, resilience and helping them learn strategies to cope with stressful environments. I mean, life is stressful and we all have stressors, and, people with autism are faced with even more stressors. And so, some people really benefit from having more tools in their toolbox to cope with these things. However, I think historically came from an approach of like, okay, there's something wrong with this person and how they think, or how they're reacting to stressors, and as long as we fix that, everything will be fine.
Right.
And so that's where I think the negative perspectives around CBT come, which is completely understandable. There's now this what's called the third wave CBT models, which are a little bit different. I mean, they're still about their behavioral approaches that include the cognitive triad, the thoughts, feelings, and behaviors, but they're really focused more on health and general well-being and identifying the individual's values. Most of what they have in common is they all usually include some aspect of mindfulness, acceptance, how to live a meaningful life. And it comes some of them are originally developed in the context of people who were in prisons, or people who have chronic pain, conditions and situations that where there were a lot of things that were outside of their control. And it has been getting applied more to people with autism, and the results, the initial studies into the effectiveness have found that it seems to be really helpful and effective. And I'm liking the approaches because it really it acknowledges the stressors that people have, the very difficult circumstances that they may be facing, but helping them have a good quality of life in that context, and be able to still have that meaningful life and the positive health and well-being.
Totally. If I can throw a question at you that maybe there's not an answer to, but are there any, I've heard parents kind of wonder, I wonder, are there any, inherent barriers because somebody has autism? Are there barriers to being successful in CBT, like whether it takes more iterations or it takes a different approach? Any kind of things that you've found in your clinical work?
So, I think a lot of these, or almost all of the approaches, were developed with neurotypical populations. And
exactly, yeah.
A lot of times, when you are, it depends, of course, on the individual that you're working with. But in general, sometimes things do have to be modified. So like you said, either it just takes a little bit longer, or things have to be, more concrete, or just broken down into more steps, or just more repetition. I mean, really, it can vary. But it seems to be that the result is that they're still effective and helpful.
Awesome.
Yeah.
I just bring that up because then I'm thinking to one of our resources at the end of the lecture or end of the talk that we have, the WISE kind of program, wraparound kind of services. We have a big push for supporting education about how to effectively kind of, provide interventions and support autistic adults and autistic youth through kind of mental health services. That's kind of going to be rolling out to different mental health offices through the WISE program next calendar year. So it's something that we're trying to, again, educate people more and more about some of these keys about, maybe you approach things a little bit differently, but you still use the same kind of principles.
Yeah. So we often, people talk about the, 8 to 12 or 12 to 16 session curriculum, and that often for people with autism, it's going to be, be longer than that. You can't say like, okay, it's going to be this concrete 12 sessions and then you're done.
Right, exactly. Yeah. It might be a longer process or an ongoing process. I see one question just kind of timing wise, it I think syncs up. Candace was asking about, do you continue therapy as an adult, or is it just something that you do in, I guess, maybe your teenage years, presumably? But I definitely think it's something that can be more and more beneficial the longer, even if you're successful, continuing to have a therapy provider or a counselor that you can kind of check in with at some interval.
And I should also say it's not something I know as much about because I'm, a psychologist, a CBT therapist, but one thing people don't often think about ABA for adults, but there are ABA providers who do work with adults, and actually the acceptance and commitment therapy, which is one of the third waves of CBT, a lot of BCBAs, a lot of the ABA therapists are incorporating ACT therapy as well in their work with adults.
Interesting. Great. Thanks. Natasha, I know you wanted to kind of chime in with some of that information from, what are more non-traditional applications of CBT. Can you talk about that and that mixed perspective that Rosalind was talking about?
Yeah. I think, there's just a very, very serious distrust of CBT in the autistic community, and rightfully so. It's kind of like with any marginalized community. It's going to be a lot more complex when you're dealing with somebody where these fears and concerns aren't necessarily all in their head. Like you might have an autistic person who's concerned, like, people aren't going to like them, people are going to reject them. And, the therapist might say, okay, like, how realistic is that? Let's maladaptive, let's challenge that. There's studies showing that people like us less from a photo. They can look at a photo and decide there's something about us that we just don't like, that they just don't like. And so I do use CBT tools with my clients, but I'm very careful in exploring. I do a lot of first really learning their world and then beginning to say, like, the biggest thing to challenge, I think, is the generalizations. Like, okay, a lot of people aren't going to like you. Okay, that's just a realistic fact. Is everybody going to dislike you? Is that a is that a realistic assumption? And really helping them to lead it, to explore, and then being open to, okay, like, traditionally there's a behavior experiment where you say, okay, you're going to go out and try this. And then the traditional CBT thing is, okay, it's going to prove to the person that their assumption is wrong. But the therapist should be open to the possibility that the person's assumption is actually correct in the experiment.
Sure, right? Yeah.
Prove it. And then, like Roz was saying, with the mindfulness and acceptance, those sorts of therapies, again, you need to navigate it carefully. Mindfulness has really been sold as this kind of cure-all, and I know more and more people are starting to realize, oh, this actually can have some negative effects if it's the wrong fit. There have been times in my life when mindfulness is very helpful, and there have been times in my life when attempting mindfulness has actually made me feel much worse, and I didn't have, you need other tools to kind of get out of that pit. And then there's other approaches besides CBT. So with a lot of clients who aren't ready to do this kind of self-reflection or questioning their assumptions, like, I do a lot of just very client-centered humanistic work. I spend a lot of time just listening to them, because maybe this is somebody where this is the first time in their life that somebody has really listened to them and believed in their perspective. Or, with me being on the spectrum, maybe the first time that they've gotten to talk to somebody who even shares their perspective and has been there.
Totally.
And so I think people really need to think outside the box. There's a big push for, evidence-based practice, the things that are proven with research, but the research studies that prove these things are usually done on the least complicated situations imaginable. So the least complicated people with the least complicated diagnoses, certainly in less complicated times than we have now. Another intervention that I really advocate for is the CPS, depending on who you're implementing it from. That's collaborative problem solving, or collaborative and proactive solutions. And that's just a completely different shift away from the behavior perspective, where it's moving towards building trust with the person and being able to solve problems together, instead of being in a power struggle for whose preference is going to win.
Gotcha. I think the complexity is really important, and I think I've heard that definitely trauma is can be an underlying factor that's important to understand, or make sure you tread carefully. Would you say, when you're engaging in therapy, about what is the trauma history that might be present for, or might be specific to people with autism spectrum disorder?
Oh, yes, definitely. Trauma is very common. Traditional traumas are very common, the bullying, sexual victimization, those kinds of things. But then other things that people might not think of as trauma, just growing up your entire life, and you have like an agonizing, when you hear a fire alarm, it feels like somebody hit you with a hammer, and everybody's going, oh, it's not that bad. Stop making such a big deal of it. Like that has a long-term effect on your psychological stability, when you're being taught that you can't believe your own eyes or your own experience. And even even the most loving, well-intended parents, there can be, it's very hard for people to hear the word trauma around this. I think we need a more destigmatized concept of this, but a lot of times even just these misunderstandings from well-intended parents can have some similar effects from kind of intentionally shutting down a child's perspective. And then also I think parents are under a lot of pressure to change their child. Like I hear again and again, parents of toddlers are basically getting the message, you need to do everything you can to change your child, to fix your child, or you're basically ruining their life. You need to rescue them. And so that puts a ton of pressure on parents to ignore their own parental instincts about what their child can handle and push them harder and farther. And so that's something that really needs to be addressed, in addition to the more traditionally defined forms of trauma, which, as I said, are also very common in the autistic population.
Totally, yeah. I like that. The parent stuff we'll come back to on that agenda, because that's one to delve into more detail about, give some ideas to parents. Before we do that, Ben, I wanted to bring you in on this kind of discussion of interventions or just kind of supports that are out there, particularly, just what's, I think Natasha mentioned it earlier, but if you can elaborate more on just how people respond to the environment.
Yeah, well, I mean, a couple of things. One is in my own worked for many years with kids, aspiring youth summer program and groups. And around 2010, I started seeing that, where do the young adults go? And it was, in our field, it was almost as though like there's people over 18, like, so much of the focus is on kids. So a couple things I would say. One, I'd really want to second what Natasha said in regards to collaborative problem solving. Ross Green and others have developed that. We'll include that on the resources later. It really is a more combined role and allows the parent to kind of figure out what the feelings are that are behind the behaviors, rather than just focused on the behaviors. Second, I would want to say, trauma has to be focused and centered. I think parents shy away from that a little. And I think one of the things to say is, like, trauma is a scary word in our culture. I think parents feel like if they acknowledge that, they've let their kid down, that they didn't intervene of that bully, that they didn't accomplish something for that kid. And it's not. I think if we go from a place of like, this does happen, this is a reality, whether it's sensory overwhelmingness, bullying, teachers who don't understand, daily microaggressions, daily things that are, and sometimes more severe. And so I think if parents can kind of say, my kid may have trauma, and that doesn't mean I'm a bad parent. That means that my kid has to navigate a very difficult road. My young adult has navigated a very difficult road. So I just want to put that out there. I think also with working with kids, and then my work with young adults, being around 20-year-olds helps me understand 10-year-olds a lot better, because I can be like, oh, this guy, I can see how this is going to look when he gets to community college or something. Like, it's informed my work so much. And I think one of the things I hope for is that there are more 20-somethings from the autism community, or 30-somethings, who get to role model and be there and interact with kids. Because I think that type of peer mentoring is great. Everyone talks about peer mentoring as the neurotypical kid who helps his peer. But I think something to be thinking about is how 20 and 30-year-olds can really be brought to the forefront, be more visible, be role models. I look to the LGBTQ community, where Dan Savage and others did something called It Gets Better, which is a national movement, and I think incredible. And that was an older generation of LGBTQ folks saying to younger folks, like, we're here for you. You have good community. Middle school and high school stink. I was going to say something else. Lastly, what I'd want to get to is just working with kids and young adults. My experience has been that kids, occupational therapists, speech and language therapists, families find the right mix. Therapist, a social skills group. I'm biased towards social skills groups.
Of course, yeah.
OTs, SLPs, there's great providers. And if you're talking to your middle schooler and high schooler about that and involving them, and I think it's great if they can be involved in setting the appointment, not just as an executive functioning piece of practice, but as really owning it a little more. And so for parents to look for ways to find that, and that's where I think Sarah Gardner, with the idea of interdependence in terms of independence, really thinking of the parents and caregivers as a team or allies with their whether teen or kid or young adult. And I think the thought for couple thoughts, up to 18, it's a lot of the support is going to come through the schools and through other supports. So obviously going to look very different this year, and that is a whole other panel. But what I would find is that it's about skill building and foundation building. And I think occupational therapists and SLPs are awesome people. I probably should have gone for that degree instead of social work, but I'm proud of us being a social worker. But I've just met incredible OTs and SLPs and therapists who are helping kids and teens build a foundation. I think at the young adult level, just like Natasha said, it becomes a bit more about relationship, humanistic approach, sometimes just being there as a support and ally. I'm skeptical of ABA for adults in a lot of situations. I think for many folks, if that's the only funding source and there's still many skills to be built, whether language, whether kind of activities of daily living, if that's the way it's accomplished from a funding point of view, I can see that. My concern is with ABA, if it is sort of a mandated approach or the 24-year-old is being told what to do or not involved in setting goals, that's very problematic. I've seen a few ABA providers really adapt it. My concern operationally within the field is that sometimes there'll be very large ABA clinics who most their techs are working with 8 and 9-year-olds, and they just add like 1 or 24 or 25-year-old in there. And it's just really hard to have the skills to then be more reciprocal, more collaborative. I do know a few ABA folks who I think are doing great jobs with young adults. I'm not saying it's impossible, but my concern primarily is operationally, if you have a caseload of 10 people and 9 of them are age 8 and then 1 of them is age 24, that's not easy to do except unless you have excellent supervision. So it's longer conversation. I see incredible work from places like Bellevue College OLS, Highline Achieve program, the Navigators, the Neurodiverse Navigators program from Sarah Gardner. Enigma ASD Services does some great coaching and case management. So I think there'll be a lot more emerging. I'd love to see OTs and SLPs. There are many who are working with young adults, but OT is literally occupational therapy. It seems to me so well suited for
It's not just fine motor skills.
Well, and I see a lot of those OTs and SLPs stepping up to that, and therapists. I'd love to find ways where they're becoming more visible and accessible, because it can be hard for young adults or parents to find those resources.
Totally.
Can I jump in and comment on the ABA question, actually?
Sure.
Yeah, like Ben was saying, I think that's an incredibly important point. I know that within the autistic community, there's just a general consensus that every ABA therapist, every BCBA, it's just terrible. Don't go near it. I will say, I think the state of the field, unfortunately, is pretty rough. All the things that you're saying about adults, and then also even for kids, like a lot of the more, top down, you're going to learn to do as I say, no matter what. Like, I don't even think that's appropriate for children. However,
okay, go ahead.
However, I will say ABA is a broad science umbrella, so that's kind of the common tone for how a lot of people are taught, from my experience. That sort of authoritarian approach. There are aspects to it, like breaking down skills, that I would absolutely want someone to come into my house and do with me to help me work on some of these cooking skills, some of these cleaning skills. So if you are able to find somebody who does these things, and so you're able to get the funding for that kind of support that the person actually values and enjoys and wants, that's fantastic. However, I think the perspective of a lot of professionals is like, well, it's mediocre ABA, but it's better than no ABA. And my perspective is mediocre ABA is worse than no ABA. Like if you feel like if your young person feels that they're not being respected, or you feel uncomfortable with anything that's going on, pull them out.
Gotcha. Well,
Yeah.
I want to be.
Any therapy.
Yeah, I think again that's I don't want to get too far down the ABA rabbit hole, because I know that there's perspectives, and I think this is the hardest thing with ABA, like you said, Natasha, when it's something that is a generalized kind of approach to intervention or approach to kind of strategizing things. You're going to have people that approach it the wrong way. I think if anything, actually, there's ABA is cut off by most insurances at 21 years old. So there's not a lot of adult ABA access when it could be really beneficial, unfortunately.
They're charging private pay.
Mm-hmm.
They're charging private pay. Again, what I'd love to see is those, again, there's some portion of ABA providers who are being much more collaborative. The Association of Ethical ABA Providers, they could start a new group and figure it out. But it is hard for parents to kind of navigate that, I think. And just to support what Natasha was saying, I do think parents, whether it's kids, teens, or young adults, keeping an eye on how the interactions are. Is it just sort of like, well, they go because it takes up an hour of their day and it gets them out of the house? Like Natasha said, that could be worse than the alternative.
Gotcha. Well, bring in the parents discussion. That's the next thing on our agenda. I think we've mentioned the parents a couple of times. I think, Ben, what I wanted to kind of hear from you a little bit more about was then how, we've talked, I think we're kind of also just automatically in our discussions, we kind of talk about, it's not just adults, but kind of, addressing mental health is important kind of, across the age range. But how do parents kind of shift, to support their adults with things, they're used to being the parent, like I think you did say, but then what is the shift that you would like to see happen in your kind of ideal situation, at least your perspective of this?
Great. Well, a couple things. First of all, parents, you're awesome. I think there has to be some radical acceptance that there's a case manager role and that you're involved. And I think talking to your kid, hopefully by middle school, high school, maybe younger if you've got a really precocious elementary school student, but really involving them and letting them know, I want to help, but I don't want to be intrusive. Again, that's a way a parent put it to me, and it's really stuck with me. It can feel sort of like, when they get to 18, what do I do? Things like that. I think one way is easing into it and knowing it's a process, that it's not about, again, that's the beauty of Sarah Gardner's article there, that it's a process. It's not about some goal of like the independence holy grail or something that you're supposed to get your kid to, because like Natasha said, that's a very top-down view. And it puts so much pressure on the parent. So I think kind of knowing step by step, looking for small gains, celebrating those wins, and seeking their input on it. Not saying, I want you to learn how to take the bus, but saying to your 17-year-old, 18-year-old, 20-year-old, 25-year-old, whatever, saying, you're wanting to go out more. Like, how can we facilitate this? I've seen some families accomplish that to lower anxiety. They use Uber on the way to the appointment and the person buses home. And so in so many cases, it's not about learning how to bus. It's that if your anxiety is up about getting to an appointment, busing's a lot harder. So really being creative in finding those approaches. I think for parents as well, kind of having support of other parents. I really encourage parents right now with COVID. One of the things is that people may be a little more receptive to reaching out. So if there was another person in your son or daughter's or gender nonconforming kids class in high school, and they got along well and you haven't been knowing what's going on, reach out to that other parent, because there's a shared experience there. One thing that I think is challenging for parents of young adults is, well, one, it's fatigue. They've really gone with their kid through challenging bullying situations, things like that. And another is just kind of lack of community support. There are many special ed PTAs. There are parent groups. I see Arc of King County doing really neat things with parent groups. Mm-hmm. And whatever can be built upon that, because I think when parents feel within their community and reinforced, they're less likely to feel the pressure of like, is my 23-year-old keeping up, or are they falling behind? And then the parent is anxious. Mm-hmm. And when a parent is anxious towards their kid, whether the kid is 7 years old or 24-year-old, years old, it makes all the other things so much more challenging. We're speaking of, mindfulness, and I really agree that meditation, it can be overwhelming for folks with anxiety in some situations. One thing though is Daniel Siegel talked about parenting from the inside out, understanding how your response as a parent affects your kid. So the number one thing you need to do is support yourself, try to maintain perspective. It can feel a lot like, what am I going to do? They have to get independent now. Even parents saying, what happens when I'm gone? Just a tremendous pressure to keep up. And what I encourage is being an ally, being a support. It doesn't mean that you're stepping back, but at the same time, trying to kind of be less anxious about it, take a longer view of it, celebrate those small wins, and know that a lot of autistic folks are going to find their path, their community. At age 20 and 21, I think a lot of young adults don't know where they're going. I suppose neurotypicals, I think the neurotypicals kind of mask it. A lot of autistic folks feel a lot of pressure to mask it, and it becomes overwhelming. But there are many young adults I work with who have incredible community, very authentic, very supportive people that they're chatting with on Discord, and which is a chat. It's like Facebook, but not for old people like me.
I just finally heard about it last week. I had never heard about it.
Yeah. And there's weird parts of that world, and it can be a little scary and stuff, but we have to trust them that they're going to stay away from the toxic people and the red pill movement and some of the yucky things that happen online. Does that mean we're encouraging them to check in with us? Sure. But the bigger picture is there's a lot of support and community out there for young adults. The Square Pegs group, a lot of organic young adult groups like mini Dungeons and Dragon groups. And for parents to kind of feel supported by that and know that their 20-year-old's going to find their path. There may be bumps in the road, but that 20-year-old benefits the most when the parents got some trust and saying, okay, there's a bump in the road. How can I help? Versus feeling so overwhelmed with anxiety about it and feeling fatigued. So whether it's a parent support group, whether it's a glass of wine, whether it's a good show, whatever you're doing to support yourself is very, very important for your kid. Sure.
With this kind of parents discussion, Natasha, you mentioned earlier the collaborative problem solving, or CPS. I think there was a question about what are some of the resources to find those providers or those people that have that training. That's definitely in our slides at the end, and I think we're getting the links into the comments section. Can you talk a little bit more about how does that CPS model work with a parent, or how could a parent engage in that? How would that help them engage with their adult child?
So CPS can be a very challenging model for a lot of people to implement because you need to go all in. It requires a significant lens shift for the parent. Basically, it's the idea that your child would be doing well if they could, and so if they're not meeting expectations, it's because they don't have the skills they need to meet those expectations at this time. And so the original book that it came from is called The Explosive Child, and it was about children who were just, melting down, screaming, breaking things, hitting people, and so on. And so it really, challenges this frame. People feel like, well, I'm the adult. I need to be in charge. I need to make my child do all these things, or, they're never going to become a functioning adult. And it's the idea of dialing back and more meeting your child where they're at. So maybe that means that you're not making them put on clothes, change out of their pajamas in order to be on Zoom for school. Or maybe they can't even do Zoom for school at all right now. Just really dialing back to, okay, what is the level that they can be doing where they're regulated, where you can start building trust. They're going to start believing that you're on their side. You're going to start recognizing, okay, they're doing the best they can. And then once that trust is established, you can start working with them collaboratively, saying, okay, I'm concerned that if you don't first you get their perspective. Okay, why is it so hard for them to be on Zoom for school? And then giving your concern. Okay, well, I'm concerned that if you don't go on Zoom for school, then you're gonna fall behind in your education. And then working on, okay, maybe they don't need to do it your exact way. Maybe they don't need to go on Zoom. Maybe they can learn, stay on top of their education through self-study or through a workbook or something. Their answers might surprise you, these solutions they come up with. So it's really shifting away from the assumption that they need to do things in a particular way rather than in the way that works for them. And so this is setting them up long term for that kind of personality isn't, or that kind of perspective isn't necessarily going to do well in a job where you're expected to just follow orders and don't deviate and everything. But for a job like my job, being a psychologist, those kinds of self-advocacy, critical thinking, and so on, those skills are those skills are incredibly important and much more useful than following instructions without question.
Gotcha. Thanks. I think I heard it mentioned a couple times already, things related to employment. And this is one thing that comes up as, a supportive, something that's, adds to your quality of life. Social connectedness was brought up earlier as well. Then we think about in COVID, this COVID time period, and really then employment is impacted. So therefore you're not working, you're not having your usual routines, whether it's the routine or just the actual, work and feeling that value. Ben, maybe you can talk a little bit about kind of how people can try and stay engaged in employment, or talk more just about that connection to mental health.
Absolutely. And my hope is that long-term, some of the ways we situate offices, some of the pressures on having tons of meetings dissipates from COVID. I don't mean that, I don't like the word silver lining at all, but there are some autistic folks online who are really talking about how meeting from home and not having to deal with the loud sensory stuff at their workplace has been beneficial to them, or not having to attend so many meetings because management's starting to see that if people work on their own a little and management trusts them, they can do great things. All the BS social niceties that are sometimes accompany jobs that can be very overwhelming and cause autistic burnout, I hope that those are diminished to some degree. I think long-term as well, employment has been a challenge before COVID. There are a lot of autistic folks who are unemployed or underemployed. It can feel challenging to kind of navigate the DVR process, which is Department of Vocational Rehab. And I've met families who have had incredible experiences through that, and the young adult found wonderful, really meaningful employment. And I think with any field, it's just kind of sometimes depends what the job is, what the manager is, what the job coach is. The one thing I would want to say is that it is going to be hard in this next year. And I encourage, I've seen parents really take some of the pressure off of like paid employment, or sort of feeling like that's the goal. Looking at internships, looking at ways to learn, to volunteer. I think microenterprise and entrepreneurship has to be something that's explored. I've seen some of the anime artwork of these young adults, some of the music they spin. They're incredibly talented. And so there's whole other issues with that. Is Etsy a way where you can really kind of support yourself completely? But I think in some cases that's a good way for a person to gain some income from their home while doing something that's creative and they enjoy it. So I think that's in the near term. I think the autism at work or neurodiversity at work movements need to find ways to not just be at the software industry level. And there's been some moves about that. Hala Anabi, I think, is doing really neat work with something called the Playbook. But why are those workshops usually happening at very high-end tech companies? And engineers are awesome. I'm not diminishing engineers at all. They should be supported. But a lot of my folks are entry-level office assistant jobs, or entry-level white-collar jobs, or data entry towards accounting. And they're not getting the benefit of those autism at work movements. So I think as a field, we need to do a lot better with saying, hey, okay, this is happening at Microsoft or Google. These are really great workshops. Why are we not getting this out to every workplace? And lastly, for parents and young adults, kind of knowing that every step you're taking towards educating yourself or gaining skills is towards employment. And if the pressure can be off, there's this thing in our culture where like 18, you just magically turn into an independent person. And if you look at Europe, people live with their family a lot longer. In a lot of places in Europe, you know, and I don't mean that there shouldn't be some level of expectations of contributing in the house, helping out, doing meaningful good things that keep you physically active, eating healthy, being aware of one's own screen time and finding some ways to moderate and limit that. You know, there's important discussions around that, but I think taking off the pressure of like, they're 18, the neighbor has a job, they have to have a job. I mean, that puts so much pressure on the whole system for them. So I would say, big picture, I hope the field improves. I hope there's more autism at work trainings, more awareness of how incredible these folks are as employees. And second, I'd say more on a family or, you know, individual system level, taking some of that pressure off, finding ways to advance with education, with work skills, but without it feeling like I must have a job by age 18, because that's some of the pressure they experience.
And I think while we, you know, wait for or advocate for and, you know, have those, you know, specific specialized programs develop kind of more broadly, there are some programs that we'll kind of link in the comments. You know, the Seattle college system has career training that kind of helps people with vocational opportunities, kind of trade fields as well. And then I know that I just happened to look at it last night, kind of preparing some of the resources, and the Washington Conservation Corps is functioning currently. You know, they're functioning during COVID time period. It's an 11-month long program for ages 18 to 25 years old. Those are some really good options that are tangible, accessible now. Go ahead, Natasha. Yeah.
I've heard good things about the Washington Conservation Corps from autistic people, and people should be aware that age limit only applies to non-disabled people. If you have a disability, you can participate at an older age.
Thanks for letting me know. They don't make that clear on the website for sure, so that's a nice little insider info there. Thank you, Natasha. Roz, talking about kind of, you know, another COVID or something that's important for people to help mitigate, help, you know, combat kind of mental health challenges, anxiety, depression. Social connectedness is a huge one. And, you know, in some ways, as you'll maybe kind of mention that, you know, COVID definitely puts us at risk for being socially isolated, but then there are options to kind of, you know, combat that again, kind of combat that isolation when people want, you know, certainly people, autistic adults want interactions. It's not just, you know, everybody as a stereotype is isolated.
Right. I mean, it's kind of in the same way that Ben was saying, you know, there are some benefits in the age of COVID to, you know, working from home and the telecommuting and stuff for autistic adults. And then, you know, some negative consequences of a lot of, you know, places aren't hiring, or, you know, there's a lot of people looking for work now. There's, you know, employment stuff. There's also pros and cons in terms of the social connectedness. So, and it's been interesting to see how things have really been modified. And so, for example, you know, a lot of the groups that were only offered in person before are now available virtually, remotely. So, for example, there's a adult social skills intervention called Peers, and some people do it locally. There's the group that developed it in California at UCLA. They're offering it online to anyone. You don't have to be living in California. And the ones here are also doing it virtually. So, so, you know, that just creates a lot more opportunities to access those supports and services. There's another example is the Pathfinder D&D group. I feel like, Ben, you should be talking about the social groups, but the, you know, Pathfinder group was meeting in person, now has moved online. And so it's been nice to see how there's been, you know, some increase for opportunities.
Yeah, and I think Ben already mentioned the Square Pegs. I think we have the link for that. That's a local meetup group. Natasha, I think you also have a meetup group from a friend of yours in California that's doing, you know, then Zooming essentially across the country, right?
Yeah, he's got activities for adults, and he also apparently has a group for parents to talk to autistic adults and get their input.
Those are both on Meetup. Again, Square Pegs is one of them, and the other one that Natasha was mentioning is Empowering Autism Meetup groups. I think we can link those as we kind of talk through things. We've mentioned Best Buddies. There was a question earlier. I've got so many comments there. I can't scroll back up to the top to see who it was. But somebody asked about connecting and love, having relationships. Natasha, do you want to talk about it all? Love on the Spectrum. That's kind of been a new, interesting thing lately.
The show.
Exactly. Yeah.
Yeah. I've not watched it. I've been hearing very mixed reviews from
what you're hearing. Yeah.
Other autistic people. No, and specifically like people, the people themselves are mixed. It's not like there's some good and some bad. It's nobody thinks it's amazing
Sure,
in my experience, but they feel they want to support the adults who participated, and they said they've heard that the adults felt respected and included. One of the common complaints I've heard is that when they're coaching them, they're really coaching them on neurotypical behavior norms, but they're setting up dates between autistic people, between disabled people. So you are teaching this autistic person how to act in a way that a neurotypical would like, when they are not going on a date with a neurotypical. Like, I remember when I was in school, I had an autistic friend, and he came over and we were playing a game, and like his one-to-one like was correcting him, and I had no problem with what he was doing. So they're getting, they're having these autistic participants, but they're not really having the autistic perspective in thinking about, okay, what would help these people most?
What about kind of some research? I think moving on to our fifth kind of topic of discussion on our agenda. What's the research telling us about autistic adults with mental health challenges? Sorry, that was directed towards Natasha. I think you had some stuff around kind of positive autistic identity, things like this.
Yeah. The old kind of neurotypical driven way of thinking about autism and identity was teaching kids like autism doesn't define me. I have autism, but autism doesn't have me, and so on. And there's a big push now from the autistic community to moving away from that. Like the example that I always give when I'm doing presentations talking about this, about, person first language versus identity first language is, let's say you're going to another country, which I know we don't do anymore, but back when we did, and you go and you say, oh, hi, I'm Natasha and I'm American, or whatever your nationality is. And the person goes, oh, you shouldn't call yourself an American. You should say you're a person from America. I don't think of you as American. Being American doesn't define you. Like, what would your inference be about what that person thinks about Americans?
Right.
And yet this is something we get all the time. I swear this actually happened to me. I was talking to a therapist. I was giving my spiel about what I experienced as an autistic person, and she cut in and said, have you considered calling yourself a person with autism? And I was just like, absolutely not. There is no reason that I need to take this thing that is an important part of my identity and distance myself from it. And, we've really, research has really been far ahead of the clinical efforts in terms of having autistic perspectives included. So we've got research coming in now that really shows that that's how it is. Like, positive mental health is associated with feeling accepted by other people as an autistic person, feeling like you accept yourself, feeling like you're not pressured to pretend to be neurotypical. And, they said positive autistic identity, they were able to kind of break it down and say, okay, the things that seem to be key here are that the person looks out and sees the autistic community and goes, okay, like there's a bunch of autistic people and they're pretty cool, and I'm part of that. I belong to that. Like that's really what it's about. We don't need to be telling kids, that they're just like everyone else. We need to be telling them, okay, there's things that are, that are different from a lot of other people, but, those can be cool and valuable, or sometimes they're not cool and valuable. Sometimes they're just frustrating, but there's other people going through it.
Gotcha. Thanks. Yeah, totally. We're past 8, so I want to kind of get to some of our questions and comments and kind of call some of these things out. Let's see. Again, I'm going to scroll kind of through some of these comments on the side here that I'm looking for. I think there was one question that I was already going to throw towards Rosalind about kind of essentially when does your child need a therapist, or when does your adult child need a therapist?
Yeah. So I think that a big piece of it is talking with the individual, kind of letting them know what the options are. If you're not sure, are they depressed? Are they anxious? What's going on here? Would they benefit from therapy? I think it's about, that participation in therapy has to come from your teen or, adult child. It's not helpful to drag them if they don't want to come, and they're not motivated or they're not interested, but you can, talk to them about that it is an option, that maybe you see some things that are stressful for them, and let them know that there are people out there who they could talk to, and that they could, there's people who can help them, problem solve, or just, process it with, and see if they're interested. And, you can also say, you're not committing to anything, to getting into anything that you don't want to do. If after a session or two, it's not for you, or you don't like the therapist, or whatever, there's other options out there. And they should feel free to say, that they don't want to participate anymore. So,
totally.
I think it's about having those, open and honest conversations, letting them know what the options are. And then if, and asking them, do they want you to help facilitate that? Do they want you to help, help you, the parent, help them find a therapist, or make that initial first contact? I definitely get contacted by parents of adults all the time. And, and then very quickly I try to assess, is this coming from you, or is this, are you just helping your adult? And then I connect with the adult and, make sure that that's what they want to do.
Great. Thanks. Natasha, there was a question for you. Somebody that saw, maybe wondering, like, do you have any openings in your practice, and how do they get in touch with you?
So I don't have openings for ongoing therapy right now. Something I do offer is what we call Neurodiversity Sessions, where an autistic person or their family, or they and their family, can sit down with me for just, 1 or 2 sessions to talk with me. For a lot of autistic people, just meeting another autistic person, meeting someone that, seems to be pretty happy, that's really illuminating for them. A lot of times I'm able to kind of do some translating, helping parents go, okay, I've experienced something very similar to what your young adult is experiencing. Even people look at me and they think, my child, doesn't speak. My child is in diapers. How could you have anything in common? But, some of the sensory things are still going to be the same. Some of when I get overstimulated, when I have meltdowns, some of that is still going to be the same. And so they can just go to the UW Autism Center, the psychologist at UW Autism Center, and they can go there and just reach out to our patient navigator and say they'd like a neurodiversity session. And I can see people through the Seattle clinic or the Tacoma clinic, but it's all Zoom right now.
Awesome. Great. Thanks, Natasha. Appreciate that. Nice little opportunity to let people know what's available for you. Keep sending your comments. We're going to get through some of these questions here. I have one that's a good one, kind of pertinent, again, we've talked about maybe some more, I don't want to downplay, mild or moderate or severe kind of presentations, but what if the anxiety is so severe? Question from Karen, what about those young adults who can't even leave the house, can't go out, and do jobs because their anxiety is so high?
Yeah.
Anybody that wants to answer that one.
I mean, I think, you know, we always talk about, you know, if you've met one person on the autism spectrum, you've met one person, that's kind of a classic thing. And we have to think about that and be aware that now different folks in this community are going to respond to the challenges of COVID in different ways. I think there will be some autistic folks who really are able to kind of do new things and adapt and maybe even have better work situations than they had before. But there are others, both from the autistic community and quite frankly from the non-autistic community, who are going to feel very stuck, very anxious. I think non-traditional approaches are good here. I think so for that parent, rather than being focused on getting them to the session office for a visit, getting them out of the house, what can be done where a therapist is doing virtual therapy with them. And also we're talking about online groups, that person's area of interest. And sometimes I think that young folks, they might have interest in aviation history or D&D or Magic the Gathering. You know, some of the folks I work with are able to find their community really easily. And they find their tribe on Discord or through video game chat or whatever. Others are going to feel pretty darn isolated and have a hard time finding that. I've seen that when the parent kind of just says, hey, look, I found this D&D thing online. And it doesn't have to be specific to autism. It could just be a D&D group. Bringing that and not bringing it as, hey, you're stuck in the house a lot, you've got to do this. But bringing it instead as like, hey, is this something you want to try? It looks kind of cool. I'm aware of a lot of work going on with virtual reality right now. I think, and quite frankly, I'm interested in looking into that a lot more and being more involved with that, because I think that's a way for a person, whether with autism, whether sensory processing disorder, OCD, where practicing a skill like going to a grocery store is incredibly hard because the grocery store is so overwhelming. So let's give them an opportunity to practice it through VR. I'm biased because I'm really diving into that and I really like that approach. And anything that's close to video games, I think is kind of cool as a treatment approach to ease people into it. I'd also say sort of steps, you know, it comes back to how can they be out the house more? Well, if they're doing a D&D group once a week online, that might be their first step. And like Natasha said, we have this neurotypical lens of like, well, they should be able to do it. It's pretty easy and they like D&D, but kind of logging on, sometimes overthinking something they said at the last session, it can be challenging. So even if that young person is logging on to a social group once a week, that's that first step. And, you know, I would venture to also say that there are services now. I mean, we talk about the service cliff. That's somewhat true. I think a parent put it to me well. They said there's services out there, but it's a very dense forest and it's hard to find your way. So I think that description for me captures some of that there are these providers out there. I've been working with young adults now for the past 10 years, and I still kind of find people, I'm like, oh, I didn't know that person was doing it. This is great. Or, I mean, the Washington Conservation Corps, I mean, they're going to be slammed with tomorrow.
There was a good response for that on the comment section I saw.
I think for that parent, if I could offer to them, you know, look for the small wins, stay really hopeful, try to be collaborative and just suggest different ideas. And come from a place of like, I want to help my young adult find some cool things versus I have to help them find cool things. Otherwise, they're never going to be independent. Oh my gosh, I have so much pressure on myself. I mean, it's a nuance, but I think it's really important to differentiate those approaches.
Totally. Go ahead. Yeah.
I think one thing to consider, like when you have an adult who's too anxious to leave the house, is to think back, what does this suggest about the expectations that have been on them so far? You know, if you were supposed to go out and find a job, but only astrophysicist positions were available, then you probably also would not feel like going out and looking for work. And people have, and that doesn't mean that, you know, you can't build up to being able to hold one kind of job or another, but the way it's presented might just be way too complex for the person or so on. You know, there's this impression that autistic people have outsized behavioral reactions. And the question that I put on parents, that I flip back to parents, is imagine what you would have to be feeling in order to act this way.
Totally.
Mm.
That's almost like a good thing
That's
just to end
true.
our entire session on. But Rosalind, anything to kind of add to
Mic
this
drop.
discussion? Yeah, right. Mic drop.
Yeah, I was going to add, and Ben, you said this in the very beginning, just about, that now, because pretty much most therapists have transitioned to telehealth, that, there are opportunities now for to connect with a therapist that can meet with, someone who can't leave the house in their home. But again, the individual would have to be interested in doing that. And motivated as well to meet with the therapist, but that is an option.
Thanks. I wanted to go up to a question that I saw earlier come through. It's from Karen, around 7:20 or so. Scroll back up there. There it is. There's a couple Karens on there, but I found the right Karen that I was looking for. I appreciate the conversation so much. I see that my 15-year-old autistic son turning inward and becoming more and more frustrated, combative, rigid. I worry about his future. How do we help him set up for success, to be his best self? And I think, again, we're talking about adults, but I do think that's a really important thing. What can we do for kind of younger people to kind of help them, not just try and figure this out once it happens in adulthood, but what can we do at an earlier age? Any ideas?
Yeah, I mean, going back to the collaborative problem solving, I think that's an approach that you can take. There's a Facebook group for it also called the B Team, and they raised a point that I just thought was so important, where they were saying that these approaches, kind of these behavioral approaches, just saying they have to do it, or using rewards or punishment and so on, that gets more and more dangerous as the person gets older. Like, you need to, that's just not going to be effective. They're going to be able to go behind your back or whatever. And so you need to be working on getting their buy-in now. And that can be really frustrating for you, because it seems like they're being so unreasonable, but it's just going to get more and more difficult down the line if you can't, meet them where they are and get their buy-in. Another resource that I like is, I believe it's called 7 Easy Ways to Motivate Someone with Asperger's Syndrome. I never remember if it's 7 Easy Ways or 7 Simple Ways, but it's by the Asperger's Experts, which is a local group of autistic people who, for some of these supports. And I like that book a lot, because it also covers a lot of, how do you build this trust and this connection, and meet them where they're at, to help them build up an actual foundation for success, rather than kind of this illusion of success that might be a house of cards.
Gotcha. Yeah, I hadn't heard of that one yet, Natasha. So thanks for that. I learn something new every time, for sure, in this world. Anybody else have thoughts? Go ahead.
Yeah,
Ben.
just a second. Asperger's Expert and Danny Reed. I think he went to LA, so he's like semi-local now. Maybe we can start a petition and have Danny move back to Seattle. But yeah, it really does come from understanding that young person's perspective, and knowing that they're feeling stressed. Teenage years are really hard. I do think having a provider, one of the great things about that is for that parent to kind of really check in and see that threshold. Where's the point at which my kid is venting to me? Right? A lot of times the home's the safest place, and a young person may be really bringing a lot of emotion, and that's the way to process it, because it's so unsafe for them to process that in other settings like school or out in the community. And so that's a release valve. Obviously we want to be aware of that threshold where it becomes more concerning or acute mental health issues. That's where it's so helpful for the parent to be checking in with the provider. But if for that parent sort of saying, worried my kid is retreating and pulling back, things like that. Right. Again, finding a provider they can connect with well, and if possible, finding natural assets or resources, a cousin who they got along with, who maybe they don't FaceTime a lot, where maybe that parent reaching out to aunt and uncle and seeing if that cousin could get online a little and form a connection. suggesting to their 15-year-old could be good. There are things like Best Buddies or other sort of mentor places where it's just giving kind of support and community. And it does take a lot of case management for parents. And that's something where if you're feeling fatigued, that's understandable. For parents out there, I mean, I think Lynn Vigo, who was the parent advocate at SCH Autism Center before, she wrote an article and she said, you are perfectly imperfect human trying to face a really hard challenge. And so if the parent's able to kind of step back and give themselves a lot of self-love and understand that, yes, you want to assess for concerning mental health issues, but also your kid venting to you and bringing a lot of emotionality and bringing a lot of their fears and concerns, that means they feel safe with you. And that's powerful. It's not easy, but it's powerful.
Thanks, Ben. Rosalind, anything on that one?
No, I was just thinking back to, I think some of the things that we've already mentioned in terms of kind of looking at the expectations and, kind of evaluating, okay, maybe the teen is feeling a lot of pressure about, performing in some way or being a certain way, or, expectations for the future that, they're just not, maybe they're on a different page or they're not feeling quite ready, or, and kind of looking at that and recognizing that there's a lot of different paths. And it doesn't have to, you just think about the messages that are being sent to that kid and trying to validate their experience and understand where they're coming from.
Great. Thanks. Yeah.
And now, David, for parents, there's going to be a follow-up blog, and a lot of the resources here will be listed, right?
Yeah, we've been plugging in the resources as we go. We have this resource slide. Actually, if you want to switch to that one, Patrick, on the back side there, we've got some advocacy support resources, some that we've already mentioned that I'll kind of go through in a second, and we'll put together a blog post kind of summarizing the summer adult resources for both without intellectual disability, like we're talking about tonight, and the resources for autistic adults with intellectual disability, like we talked about last month. Suicide prevention lifeline website, great resource there. If you're trying to access mental health services, just start by calling your health insurance, reaching out to Medicaid. With Medicaid, you can ask for a case manager for behavioral health support to kind of get you pointed in the right direction. Like some of the parents asking tonight, if you're, again, goal is to talk about adults here, but if it goes into kids as well. And if you're under 18 years old, you can access the Seattle Children's Mental Health Referral Service. It's actually the Washington Mental Health Referral Service through the Seattle Children's Hospital. That's a great resource online to kind of help with finding a provider in the community. Washington Autism Alliance and Advocacy. We talked about also Arc of King County a few times tonight. We talked about wraparound services through WISE. And then here's the one link, and then the kind of information for the OHSU website, two kind of main resources on collaborative problem solving that Natasha talked about. And again, just kind of having the suicide resources at the bottom there, talking with somebody, texting with somebody, a great new option, to reach out if you're in crisis. I do want to say, that as my Seattle Children's representative, I love the discussion. We do represent, or we do support ABA therapy, 100%, meaning it's supported 100%, not for 100% of individuals, certainly. But I just want to kind of put that out there. And there's still ways to improve on many different types of therapies, and not every therapy is for every person. But I just want to put that out there. With that, I want to thank our panelists tonight, Rosalind, Ben, Natasha. Thank you so much. It's been a great discussion, really lively. I had a lot of fun. I learned some things. And so it's always great when supposed experts like us can all learn something from a night of discussion. So thanks, everybody. We'll see you later.
Bye.
Thank you.